Michael Fraser is with me now, the Executive Director of the Association of Territorial Health Officials. Thank you for being here.
Sure, good morning.
We have been talking so much about the mission of APHA and this concept of being the healthiest nation in one generation. So what I would ask you is, what do you think are the most important steps to reach that lofty goal, and how can we come together to make it happen?
Yeah, it's an incredible goal, isn't it? It's so audacious, I love it. And to think that APHA is the organization to lead this is right on. I mean, the partnerships that APHA has, the work of its members, really will contribute to achieving that mission. A healthier generation, we're all about healthy generations, really. I mean, in terms of working with our members in the states, they share that mission. So I think amplifying the APHA goal with what we're doing in our states and territories and their work is a really key strategy to move APHA forward.
How do you address some of the challenges? For example, we're delivering healthcare, or trying to everyone on a daily basis, but then you have unforeseen challenges, like for example the Zika virus this year.
Right.
How do you stick to the mission and then address some of these new problems?
It's a great question. I mean, what's not public health? That's, we spend a lot of time talking about what is public health, what's not public health, and these things pop up. And it's really about a system that's prepared to do the core public health work that we all understand, the environmental health, the laboratory, the epidemiology, the maternal and child health, but also being prepared for these emerging issues, which are happening more and more frequently, if you think about it. So not only do we need to build capacity in our states and territories to respond to things that are daily occurrences, but also some of these emerging challenges like Zika, and it takes a strong public health system. Absolutely.
And you talk about the states and territories, but yet everyone needs to work together.
Right.
Do you have specific strategies to really bring people together like that?
So a lot of what we do at ASTHO and with our members in the states and territories is convene. There may not be an issue that we're an expert on, but we can get the experts around the table to work on policy at the state level and also programs in communities and how they impact the state health outcomes. So there's a lot we do with our members to build that kind of work.
And how specifically can you work with APHA in order to achieve that goal?
Well, APHA is this great big tent that we're all part of. And it's academia, it's governmental public health, it's research, it's community organizers, it's people from across the country and around the world really interested in improving health. And I love being a part of that. I think just being that convening expert that APHA provides really allows us the chance to get together annually and virtually throughout the year to work on these important issues.
I know you're relatively new in your role. Can you speak to us about what your main goals are?
Sure, so our main goals, I am relatively new, I've been there about 2 months. Our goals are to help build the capacity of our members to lead state and territorial public health agencies. They are leaders in really different ways across the country, working with their governors and their cabinet colleagues to improve health across the country, and getting them to understand what a multi-sector approach would be. Getting them to move from healthcare delivery into public health is a challenge in some places, and in some places they do it very, very naturally. So preparing our leaders to lead public health change and get to that vision of a healthy generation is a main goal. The second big goal we have is to really increase our voice for public health. So we're talking about how public health officials in Public Health 3.0 should be chief health strategists. I'm really interested in helping public health professionals and leaders become chief health advocates. So we're in Washington for a reason. We want to advocate for the nation's health with APHA, with our partners, and get our members up to speed on all of that kind of work. And then finally, helping our states do better. There's a ton of work to do out there, and that's a huge goal for us.
Well, if you reach your goal, we're all better for it. Thank you so much.
Thank you.